I chose Stanford Surgery, first and foremost, the people here. When I worked with the residents, worked with the faculty, I had such great interactions. I found people were really supportive. I always loved the resident teams I was on. And for me, that was really important when it came to choosing where I was going to be for 7 years, was to choose a place where I loved the people. I think the other thing for me was the diversity of training sites. So we work at several different hospitals. And I really like that we get to go see different places, how different hospitals work, how people do things with different sets of resources. I think it makes you a better doctor to be more sort of flexible in the way you approach things. And also, even if I end up working in an academic hospital someday, knowing what it's like to be at another hospital where certain things aren't on call all the time. So for me, kind of those two things, plus living in the Bay Area, which I absolutely love, it was a no-brainer. I had a sense coming in that I would end up doing something like health services research type work during my PD years. I think once you're here, you're clinical, you're meeting with people, then it sort of evolved for me what exactly the field would be that I did more of my work in. Prior to residency, I did a lot of work in trauma. But once I was a clinical resident, I realized that I wanted to focus more broadly on general surgery and the elective surgery angle. I am working with Dr. Ren during my research time. We're doing several projects on how to optimize patients ahead of surgery. So we have two projects, one looking at patients with heart failure. And you know those patients have heart failure going into surgery. What are the things that put them at high risk of having problems after surgery? And then are there things we can do to change that ahead of surgery? So that's one angle. The other angle is looking at ambulatory surgical centers, so kind of places that are disconnected from a hospital. A lot of patients have elective surgery there, but we don't really, as a country, have a great handle on what happens to those patients in the month or 2 or 3 after that. So we're starting with kind of mapping what's happening to those patients in the time after surgery. In an attempt to then better understand, okay, where can we, again, improve things either ahead of surgery or at the time to help improve those outcomes. In addition to that, I'm getting a master's in health policy at the university. So working with their team there, they're sort of supporting me on the methods side of things, helping improve my sort of skill set as Dr. Ren and I work on these clinical projects.